So then he said it's not going to cut the mustard.
Really?
You know, and that was that.
Let's try a little test. What do you see here?
It's a sandwich. It's a sandwich. It's a sandwich.
I'm sensing a pattern here.
Dax Wall Street! Dax Wall Street! Dax Wall Street! Dax Wall Street! Dax Wall Street!
Because our patients are suffering. They come to the hospital sicker because they don't have health insurance. And they don't have health insurance because they've lost their jobs. Thanks to the big Wall Street folks. It's time they paid their fair share.
We talked about the reasons why you guys were doing this the other day and why Chase Bank. But just kind of give me an idea of the actual patient stories that you run across that bring you out here today, that have spurred this whole movement by National Nurses United.
People have lost their jobs, so they've lost their health insurance. When you don't have health insurance, you don't tend to come to the hospital until you're really sick. I mean, I've taken care of people who are there having an asthma attack because they can't afford the money for an inhaler, and an inhaler would keep them out of the hospital. I mean, it's not rocket science. I've taken care of people who are diabetic but don't have the money to pay for their insulin, so they come into the ER and their blood sugars are high. We send them home with no insulin. I mean, how outrageous. I've had to do that. That's ridiculous. Healthcare is a right, it's not a privilege. And if you ask the countries in the rest of the world that have national health insurance programs and whose mortality rates, by the way, are much lower than ours, you would understand that that's what we need to do. Single payer is the only way to go. Our veterans have single payer health care, and senior citizens have single payer health care, and you don't hear them complaining. You try to take it away from them and there'd be a huge uproar. But we have to take care of the average person too. You can't have health care just because you happen to be lucky enough to have a job. There's 51 million people working in this country every day who don't have health care because they have minimum wage jobs. And they work for people who don't offer health insurance. It's criminal. It's criminal that only the rich have access to health care, or the wealthy, or the people with a job who have insurance.
How well has your message been received by other nurses around the Miami Valley? Would you like to see more nurses out here today? I would, but I understand that nurses who work in private sector hospitals risk losing their jobs if they were out here. I belong to a union, so I can speak freely and I don't have to worry about that kind of thing. And the other nurses who are here that belong to our union, there's one union in this town, one hospital that's unionized, and we have National Nurses United, and that's the VA. But other nurses would love to be out here, but they can't because they would risk losing their jobs. Risk retaliation, and that's wrong too. People ought to be able to, this is America. Exercise your First
Yes,
Amendment rights
absolutely. Or retaliation, that's right. That's absolutely right.
What would you like to see happen next? I mean, do you think, realistically, we're not going to see much moving between now and the election on a lot of issues. Maybe we will, but...
It depends. If we can get enough leaders, enough people to come forward. National Nurses United is all across the country. We had a huge rally in Chicago the same weekend that NATO was there. We had a rally in Daley Plaza. 1,200 nurses plus people from other unions were there supporting us. And that was our kickoff. We'll continue to do this however long it takes. National Nurses United is committed to that. To do whatever we can to get Congress moving.
You also think national health care would help spur the economy, especially like maybe the entrepreneurial economy?
Probably, but what it would do is it would get rid of these greedy healthcare insurance companies. They're in business to make money, not to provide health care. And so they deny as much as they can to people, and that's why people do without, even those who have health care, you know, and some of them have lifetime limits. That's one thing that Obamacare would do away with, is there wouldn't be lifetime limits, and you know, kids would be able to stay on their parents' insurance until they're 26. And health insurance companies are saying, I read in the paper, that even if Obamacare was abolished, they would still keep that, keeping kids on their parents' health insurance till they're 26. But that's not because they're so generous. It's because young people don't get sick, so they don't use the health care dollars. So they can make themselves sound like they're being so altruistic and they're so generous, but they're not. They're not losing any money in this process, in this situation. So
thank you for your time.
thank you. It was nice meeting you.